name is Andrea D., and I'm a hired consultant working on the community-based marketing part of the Healthy Corner Store Initiative, which is operating under Plan4Health in Kenton County. Next slide, please. My community-based marketing started with logo development for the stores, something that they could brand the project with in their store, and then we carried that out throughout community programming. So we started with two different logos. One says Shop Healthy Here for store windows, store signage, and then also another logo that says Eat Healthy, Be Healthy. So that is going to be put on different items in the store that you can purchase, and also rack cards and things that are distributed throughout the community. The signage is developed in English and Spanish. We do have a Hispanic grocery as part of our corner store program, so we do have bilingual rack cards and logos distributed. So the next piece we worked on was a rack card, and that's just really a half a page flyer, basically a front and back really colorful card that has images of community folks on it, fruits and vegetables, and other things I'll show you here in a couple of slides. And then also worked on just getting the word out. So the rack card initiates that. Any community events that are happening that can be passed out at, also just on the counter at the stores, and then in schools. So we have made partnerships with the after-school programs in the schools to do some different youth incentives, and also to distribute this information to families in Covington specifically. Next slide. So this is just a picture of different store signage and decals that were developed. Kind of the slogan, Eat Healthy, Be Healthy, is on a banner in the stores, and then it says, Fuel Your Day and Feel Good Too. So then there's a logo next to it just to kind of brand the project and make sure everybody's kind of understanding what's happening exactly. So that's a banner that is used on A-frame sidewalk signage and in the store as well. And then the other 5 images are made into decals, actually, that are posted on doors of refrigeration units in the stores. They also stick to metal. We did have additional decals made that would go on the counter of the store cashier kind of area, and also the logo will be on the door. These healthy tips were developed with a partnership with the local health department. So they kind of provided the text, and dietitian kind of approved this for helping folks to integrate these healthy choices into their meal plan. Next slide. So we broke the programming into 2 areas, youth and adult, naturally, and then something that this team had asked me as a consultant to do was work on a Healthy Bucks program to encourage children to make wise choices after school with their snacking especially. So on top you'll see a wooden nickel is what we chose as our Healthy Buck. They're relatively affordable, maybe like $0.25 a piece, and then they're valued at $1. So they are distributed through after-school programs at the schools, and then they're redeemed in store, and there's a deadline for redemption, and then the stores are reimbursed for that $1 amount. So this token says the stores that are involved and the dollar amount and the deadline. We also in our area, the health department promotes National Nutrition Month through the schools in March. So we created 4 events to happen after school, 1 at each corner store, where children can come in and get a grab bag, which is a mystery bag. They won't know what they're getting when they take it, but it'll be a healthy snack. So this is an initiative to try to get them to try something new that they wouldn't make that choice on their own. Hopefully they'll like it and come back and try it again. And also we worked with children that are part of leadership programs in the schools to take images of them kind of having fun with fruits and vegetables. They also, on these days that we went in and snapped these photos, they were able to sample a lot of things like hummus, smoothies, trail mixes, things that they might not purchase on their own as a snack, just to see if they like it, and they're able to record what they thought about it and relay that to the shop owners. And then we just used some kind of fun messaging on those pictures, and those will go up on the store window. Next slide, please. The other half of the program is adult marketing, incentives, and programming. So we've scheduled to kick off in-store kind of programming, 8 sampling events that are being coordinated through our UK Kentucky Cooperative Extension Service. So they are going to offer sampling of different recipes that will also be available in the store. There's going to be a recipe card station in each store. We've already kind of started that work, so that will be coordinated through the Extension Service to refill those recipe cards on an ongoing basis, and there'll be a display right there with the fruits and vegetables. The 8 sampling events will just really sample one of those recipes, and then in addition, we're doing a soup sample day at a market that is across the street from low-income housing, right out in the parking lot. Our program is running through the winter, but we wanted to do something outside to be really visible, so this is an effort to get folks to walk across the street and see that it's happening. And then we included one window poster that was an adult image of a pregnant woman, healthy for you, healthy for two, in our window messaging. So this is just the rack card that I've referred to that list kind of a kickoff to everything that's starting, and also a coupon. So we had our 4 store owners, we asked them if they'd be willing to offer a coupon, and they said yes, so that was included in this piece. And then also social media, a brief description of the program, what stores are involved. Next slide. We did want to gauge the interest of what people wanted to buy in the store, so we used the leadership youth program to kind of see what the kids thought about different products, and then developed a survey that was given out to WIC users at the Covington Health Department clinic, and that survey generated 65 responses, and we offered a raffle bag that was donated by the Extension Office of just a cookbook that had easy recipes that were affordable, and then different cooking utensils in it. Next slide. So thank you for your interest in the program. If you have any questions, my name is Andrea D., and this is my contact information.